Hi, I'm Dr. Rama Subrahmanyam, a higher specialty trainee in emergency medicine at Lincoln County Hospitals. Now, the Truman Show stickers and the guidelines are placed in an orange folder like this, which is kept at various entry points of the department. The doctor or the nurse at the entry point takes the Truman Show sticker and places it in front of the notes for patients presenting with chest pain and/or abdominal pain with high suspicion of aortic dissection. The doctor who picks up the notes later follows the guideline, and if the patient has two or more features of Truman Show, a discussion is done with the senior doctor and fast tracked for CT aortogram. If the patient has one feature of Truman Show, it's an intermediate risk. So other possible differential diagnosis of chest pain are ruled out, and then again fast tracked for the CT aortogram. Truman Show, we had 3 PDSA cycles done over the period of 5 months, out of which we detected 32 acute aortic syndromes and 20 aortic dissections. This was, of course, discussed with the trust guideline meeting, and it got approved. And it's also been implemented in other EDs like Pilgrim, Grantham, and we are considering it in Leicester as well. The CQC rating in Lincoln rated Truman Show as one of the best outstanding practice for quality improvement project. But the best reward for me was my patient's personal experience in the form of a video regarding my Truman Show.
Hello, my name's Daniel. I'd like to talk to you about using a screening tool called the Truman Show, which one of the staff cottoned on and thought to use the Truman Show. Now I'm feeling pretty well, and yeah, it was all thanks to the Truman Show, really.